I think the focus is probably on my new assignment as the Health and Medicaid representative on the Ways and Means Committee. And I think a little background on that might be beneficial and useful. We lost one of our members last summer for health reasons, Representative Phyllis Pond from New Haven, Indiana. And she had this responsibility until that time, a lot of years of experience. And then also Representative Bill Davis took over the Office of Community and Rural Affairs assignment, and then that resulted in him leaving the House of Representatives. And so Representative Tom Dermody has taken the position he had on the Policy Committee, one of the 25 standing committees that we have within the House of Representatives. And in doing that, then there has been some reassignments, and I ended up with the Health and Medicaid Policy Subcommittee of the Ways and Means. My responsibilities there really have to do with the fact that we cover so many issues, and then these subcommittees, there are other subcommittees like on K through 12, higher education, and so on, relate a great deal to the percentage of our budget that ends up being spent in those areas. Consequently, it is good to have someone on the committee assigned to an in-depth review of any of those issues that might come under that subcommittee. And since mine is health and Medicaid, we're well aware of the discussion that's going on and what Indiana is doing in relation to the Affordable Care Act and the expansion of Medicaid. The subcommittees have to do with somewhat with the amount of funds that are appropriated each year for the various aspects that the state of Indiana has responsibility for. And I might just mention that Medicaid, for example, in our biennium appropriations for 14 and 15 is about 13% of those appropriations. And then if you add Health and Human Services, you add about another 9%. Consequently, 22% of the appropriations out of our biennial budget are related to Health and Human Services and to Medicaid. So you can see why we have these subcommittees. I think that helps you understand that. And then I thought I might just touch a moment on this Medicaid expansion. We will still have the traditional Medicaid, but we will use the Healthy Indiana plan to cover those individuals that are beyond what the traditional Medicaid coverage currently is. And we have received approval from the Health and Human Services, the federal agency responsible for administering these programs and providing the funds that we use to continue they're really calling it a pilot program for Medicaid. And one of the requirements to continue that program was that we keep the eligibility to 100% of federal poverty level, which at the current time is about $23,000 for a family of 4. So there are about 13.4% of Hoosiers that are not covered. That amounts to about 880,000 individuals. Certainly we're not taking that level at this point, but because that would be up to 400% of the federal poverty level. The minimum threshold for the Medicaid expansion under the Affordable Care Act is 138% poverty level, federal poverty level. So you can see that from 100% to 138%, that 38% amounts to about 100 to 150,000 individuals. And so we're going to use, and the governor's asked and received approval to have the Healthy Indiana plan serve as the basis and the core or the skeleton for for considering those kinds of services. And we will continue to work on fine-tuning how we might administer that. I think it's important to kind of remember on the Healthy Indiana plan that it does provide those individuals the opportunity to somewhat participate in their health care. And by that I mean that they can have a power account that allows them to, it's up to $1,100, and it's based on their income. They can use the funds, and the state provides those funds, providing they meet certain criteria. And predominantly, the incentive here is to move individuals away from emergency room services, which tend to be more expensive, and to have them participate in preventative kind of care options. And so the incentive here to create a power account, which is like a health savings account in a way. If we create that power account, can put $1,100 if they meet the criteria. Of course, it's kind of scaled on income, but nonetheless, there's up to $1,100 to help people with their health care, and they end up participating in their health services, and they end up doing some of the preventative care kinds of things, having annual physicals, smoking cessation, and those things that can have the impact of reducing healthcare costs overall. And it is also beneficial to them. So at the present time, we're interested in using the Healthy Indiana plan as Indiana's expansion of Medicare.